Welcome to Long Term. I'm Ty King, and this podcast we've been talking about the different types of recovery, and we're looking at what resources are available, what do we need to do to have a sustainable future for just human beings and society in general. For the things that aren't really comfortable to talk about, all of us have gone through something that we need to recover or heal from, and making those conversations being loud and heard and knowing what resources we need for those to actually be sustainable and viable for the future. And one of those huge parts of this that I really didn't anticipate in the beginning is just how important it is to have access to medical services, right? When you think of going to the hospital, or you think about going to the doctor for just a checkup, and especially we're seeing more and more people that are having to go to the emergency rooms because of overdoses or some sort of physical thing that's happening to you, and you need immediate attention. We think about what's after that? Like, yes, you receive the help, you receive the medical attention that you need, but then there's also the bill afterwards, right? And so insurance is really, really, really important. So I really wanted to have a conversation with someone that's an expert in the field and talk about, what is available, how is everything being affected, especially in today's world, and how everything seems to be changing on a daily basis. But what are some things that we can count on? How are they helping? And do we have a positive outlook for the future of how we can improve things? So I wanted to bring on Ramdev Regulapati, who is the founder of My Physician Plan. And I'm just so excited to learn from you and to get some attention on this very, very important subject that we have not even covered yet. And so glad to have you. And thank you.
Thank you for the opportunity, Ty. Happy to talk. Happy to share my views and whatever we have learned. So the way we came about My Physician Plan, we have, people with insurance, people without insurance in any community. Unfortunately, people without insurance are left out, and they may be going through a lot of different issues for whatever reasons, and then they are left to go to urgent care, or they may end up in ER, and then they get the care. So why is that? So then we said, okay, fine, what's going on here? And sometimes they come to primary care doctors, and the primary care doctor says, what plan do you have? Okay, I don't have anything. And then they'll say, fine, pay some, we're going to charge you $150, whatever, for the visit. Let's say sometimes these people pay that money, and then the doctor says, I want to do certain tests. They say, no, I don't have money, I don't want to do that, I don't have a plan. And the doctor says, come back for a visit. I says, no, I can't. So there's a disconnect. So there are a lot of episodes like this. So why some of us should have access to this local doctor who can take care of us and our families anytime there's a problem, and then why others are left out, why they should not have access to the same services the rest of the population has. So why we have two parts of this population? We can't. So then we said, fine, look, that is not fair. Let's at least come up with a plan that can give access, same access, that whether you have a Cigna or Aetna or whatever plan you have access to the doctor to go get the treatment. Why not have same access to all these people who do not have any plan, and then make it even premium? So we are calling it even premium primary care. So that way it's affordable and anyone can join any day. Let's say, Ty, if you want to join today, you don't have a plan, they should be able to just go sign up and then just become a member. And then they should be able to go see the doctor and get the same privileges. So that is the main essence of what started us saying, how can we bring the rest of the society who are left out, have the same access to this? That is step number one. Once we do that, then we can build on top of it. So that made us start or launch My Physician Plan.
Yeah, that's an incredible needed resource for people. And to make it simple, I remember the old the Affordable Care Act website where you used to go on and and it used to be a lot different than what it is today's form. And I think it may even be, I don't even know what the status of it is now. But I know now if you go on there and you put in your information, then you're going to have to expect to wait a few weeks still to even hear back from some of the what's been decided, or if you need to go talk to DHS or whoever it is to get your plan approved. So with my physician plan, the ease of being able to go on and to sign up right there and directly, you still have to abide by the enrollment periods. Is that correct?
So we took that out. So again,
Really?
those are again restrictions that you're putting on, right? So if you say, give this information, give that information, do you have this condition, that condition, this restriction? That again is a problem. We're not solving anything in that case. So just take that out, give a plan that can allow anyone and everyone to just go sign up on their own. Or if they need help, member support can help them out also. They can sign up with, even with a 1 month plan. So we always ask at least, say, don't just go with a month, at least try for 2 months. So you and your doctor has some relationship. So they should be able to sign up on their own, no restrictions, nothing doing. And then once they sign up, they're good as you and anyone else who has any other kind of plan, even better. And now they have a doctor that they can go to. So no restrictions whatsoever. Anyone can sign up on their own. And
That's
if they need, they
incredible.
can they can always use member support.
And that's something, my own ignorance coming into this. And I think maybe just part of it is that we just accept some things as just part of life because we've been so used to it for so long, right?
Yes.
I thought that the enrollment periods and things like that for insurance were just maybe a national law or something that we had to abide by. But that's not true. You're saying that you can just change that depending on the company.
Yeah. So what we have is there are two types of plans. There is a primary care plan, and then there's a comprehensive care plan. So when you talk about primary care plan, anyone can sign up anytime, no restrictions, no enrollment periods, nothing like that. You can even sign up today and then book the appointment today also. No one is going to say, hey, oh, just because you have some problem, looks like you're getting the plan, and then the plan has to pay all this money, and then that's kind of exploitation. No problem. That's what, don't worry about all that stuff. Just take it. You can go and book the appointment. Doctors are going to see you, and then they'll take care of you. When it comes to the comprehensive care plan, a lot of small businesses, I mean, not just these individuals, they're gig workers, there are a lot of other people who cannot afford insurance, right? Who cannot sign up. For those, we require you to sign up before beginning of the month. You don't have to wait for months and everything. So we just say, just try to enroll before the beginning of any month, and that's about it. That's the only restriction we have over there. But primary care plans, you don't have any restriction. Whether you buy a comprehensive care plan means you have primary care, plus you have coverage for hospitalization, specialists, and anything else. Depending on the price points, depending on their affordable, always this is cheaper. Like primary care plans are less than $75 a month. So depending on the price point, depending on the requirement, they can sign up for any one of those plans and then move forward. So that's the only restriction we have is that you sign up before the beginning of the month. And again, there's no restriction based on your status, financial status, legal status, or work status, or any status for any of these plans. There's no restriction as such.
Wow, that's incredible. So for you, what was the inspiration? I know you mentioned a little bit about how My Physician Plan got started, but for you, what is the motivation to start something like this completely new?
So the healthcare system is broken, right? So in a way, everyone says that, and then they say they want to fix it. And then on the other side, you look at national debt. The debt keeps increasing, and then they'll talk about cutting the benefits. So someone else who's getting the benefits are going to lose out. And we keep hearing that there will be 10 more million people will be added to there are 30 million people without insurance, and there'll be 10 more million added. And then what about all the gig workers and the small businesses that are not able to pay the premiums? And then who's going to pay for it? Then they'll say members have to pay for it. It is supposed to come from their pockets because the business cannot pay for it, or 50-50. So we see this is going in a wrong direction. We figured we have to solve this problem. You just cannot solve it by just talking or giving lectures and whatnot. We said, fine, let's do our part. We can't solve the whole thing for everybody, but we know the basic problem is this. And then we have seen this again and again at primary care doctors' offices. I'm affiliated with one. When these people come in, we felt it's really not fair. It's not moral also. Why some of us should have access, why others should not have access. So one motivation was to see, can we solve this problem? Start with something. Start with primary care, and then start adding, the remaining components. And then, so that was one motivation. Then obviously looking at what's happening to the healthcare industry and what's going on. I believe, some people serve in the front lines. They put their lives. Some people serve in different ways to help their country and the society. And this is one more way of serving also. So if you cannot do those things like the brave people do and do that every day, you can do something to help the country and the population in one way or the other. So we figured, instead of just crying about it or complaining about it, why not do something about it? Whether we'll succeed or not, God knows, and then we'll give it our shot. But hope, so far at least so good. So we're able to make a difference, and that is a motivation to even move forward.
Yeah. And, this show is mostly, about, people who are in recovery from something, which a lot of them need medical services, but this is something that it just applies to anybody in your community, because more and more, people find themselves in a position where who doesn't like affordable, insurance, right? Like you said, the system is broken. I don't want to pay $1,200 a month for my insurance plan. But being able to find something, and I also don't want to wait till November, December to even enroll, or to change my plan. So this is incredible that you're offering this. I can't believe it doesn't have more attention on it than what it has. But what has the reception been for you? I guess even throughout the medical community, or through media itself, are more people picking up your story and covering it?
Now it's picking up. So it is again, this is a very difficult problem to solve. It's not easy. So it took us a couple of years to even to come to this stage. There are a lot of moving parts, a lot of restrictions, a lot of components to work with. So first we have to solve the problem of enrolling the doctors, right? So now we started with one or a few doctors in one location, and then now we have 700 plus providers and doctors in 35 plus states. So it's just growing, and some people are coming and joining on their own. And then you have the problem of saying, okay, what do we do when people get tested? So, who's going to pay for it? All these tests are expensive. Even if you have insurance, regular insurance, because you have a $5,000 deductible plan or a $10,000 deductible plan, most of the tests you have to pay out of your pocket, and they're very expensive. So now you're saying, okay, fine, we're trying to solve the problem. So who's going to pay for the test? How do we do that? So it really took us some time to bring LabCorp on board and integrate with them. So now members are able to go to any patient service center throughout the country. They can walk into any LabCorp patient service center and get tested. So that took us some time. And then we had to work on getting the prescription part covered. So then, if they get prescriptions, again, these are expensive. How do we make sure what they pay out of pocket is low? So everything took time, piece by piece, piece by piece. And now it's just catching up. We are getting a lot of attention from a lot of different sources, and it's picking up. So I think this year and the next year, we should be not just 35 states. I think we will have providers in all the 50 states once we have our network. And then in terms of population, we are targeting U.S. population. Plus, what we started realizing is the international inbound, what we say inbound traffic or inbound people, they're visitors, or we have international students coming to this country. About 1.2 million students come every year. So we are trying to go after those plus the US population, not just the US population. We are saying whenever anyone comes to this country, they're also having the same problems with healthcare. So we make sure when they're visiting and giving us tourism dollars that they are also equally have access to proper care. So we are solving that problem. And these international students are really important for us to come in for all the schools. And then same problem that they are having too. They don't have proper coverage. So now we're getting a lot of traction from all sources, both from international as well as US population. And we are also trying to reach out to all the small businesses in the country. So we are working with different platforms. One platform has like 20,000 small business members in there. And then there is one of the largest payroll provider in the country. So we have integrated with their platform. So anyone who does payroll with that, now they will have access to our plan also. So small business will be able to offer that to their employees. So I think we will start seeing a lot of impact as we move forward, both for U.S. population as well as for the international folks coming in.
Yeah, that's incredible. And what is that impact that you think we'll start seeing?
So on the U.S. side, if you talk about the domestic, the population, when it comes to care, when we say premium primary care, right, the most of the people, you don't know anything about what's happening. You're guessing, you're going here and there. So now when we say premium primary care, all of a sudden, all these patients, all these members will have unlimited access, unrestricted access, whether in person or through telehealth, right? Anyone who's coming in will have access to a dedicated primary care physician. So now when that happens, both the doctor and patients will have a complete idea about what is happening with you. And that relationship will be formed. So whether you're someone who lives in the US forever or whoever is coming in, they can be rest assured that they have a proper relationship with the doctor, between the doctor and the patient, and they don't have to worry about the number of visits or that they have to pay out of pocket. All they're responsible for is a small copay, and then the plan takes care of the rest. So, and then even if the doctor is ordering some tests, they know they don't have to say no, or they don't have to worry about paying out of pocket, because again, it's just a minimal. Right? Maybe they're paying $5 for a test or $10 for a test, and same thing with the prescription. So when you have that relationship, so they know now they can go get treatment, and they're able to afford the test, and the doctor has a complete idea about what's happening. When that happens, and when we say unlimited visits, anytime there's a problem, they can call, right? Even in the middle of the night also, they'll have access. So when you have access and relationship between the primary care doctor and the patient or the members, when you talk about recovery or any other problems that are there, so the doctor is able to catch anything that's happening with the members before anything happens. And then now, with that relationship, what we are seeing is, when they are in the room with the doctor, it's not just medical. So they'll start opening up. Now that you have a relationship, now you have someone who you can trust. And then because you don't have to worry about paying out of pocket, you are easy to book the appointments now. And then the doctor says, I want to see you in 2 weeks. You'll say, no problem. As opposed to saying, oh, the bill is going to come to me, I have to pay for it. So because of that, on one side, we are saving lives. A lot of members have said, we have saved because of the plan, our lives are saved. Because otherwise, they would have gone for maybe some urgent care visit, and then the relationship is not there. You can't find the problem or fix it. So because of this access, lives are being saved. And then because of the relationship, they start opening up. When they start opening up, then they'll talk about any addiction problems or other mental health issues or anything else. Now you have a friend who is a doctor, who is sympathetic to you, and then they're trying to maybe sometimes domestic abuse, maybe some other stuff. They can't open up everything. So what we are seeing is, we are able to provide this access to people, and they're improving their health. You're saving on the other side. But at the same time, the mental health component or some other issues that are being there, those are getting affected also. So we are able to make a difference over there too. So in the long run, by giving these plans that are accessible, whether there's primary care or comprehensive care, right? So these are two things. And whether you live in this country or whether you're coming from outside the country and then being here, with that in place, you're really going to have a big impact. So you can solve the health problems. At the same time, we can solve anything that's bothering them both from a mental health point of view or anything like that. So we are seeing that difference. We will see, unlike traditional insurance plans where you pay and then you may not, and then you're always afraid about restrictions, approvals, prior authorizations, and paying out of pocket, and then use it on a limited basis. Now all of a sudden you have open access, free access, unlimited relationship. That solves a lot of problems. I wish it was like that for everyone. But so this will be better than what you have in terms of whatever coverage that you have. So we see that it's going to make a big difference when it comes to health and also for the mental health.
Wow, that's really encouraging to know that something like this exists and that it's available to people and that we don't have to wait for it. It's not just an idea. It's here and we're waiting on it. We're just waiting to see the results. So thank you so much for creating this and for coming on the show and to talk about it and to make sure that people are aware and educating myself. Like I'm going to check this website out after we get done here. So where can people go to find out more about my physician plan?
So the website is myphysicianplan.com. So you can just go there and then click on, you can just browse through. We made it very simple. for people to understand. And then you can click on, if you are an individual member or looking for a family, click on the members page. There are different plans available. You can sign up for any plan that you want. Just try it out. There's no restriction in terms of continuing. If you don't want to, you can cancel anytime. You can join anytime. And then if there's gig workers, small businesses, again, they can always sign up. At least they can reach us, and then we can work with them and then try to see how we can set it up with them. So, and obviously, any international folks, maybe we live here, but we have relatives or friends, somebody who wants to visit us. When they're in this country, it's really important for them to have proper coverage. The same problems they will also have the same impact. So they can also go to the site. The international students is different. Obviously, we go to colleges, or maybe our kids go to colleges, and then they also have access to the international students, and they will be complaining about how bad it is in the U.S., how good it is in UK or somewhere else. We say no, we understand, but we have there are options. These are affordable, and you can do that. So we want anyone who's coming to this country also feel good about us. It's not like they can complain, they can say bad mouth about US, but no, we are fixing. We have options. You can look at that. So we want to make sure anyone who comes in also has a good experience about us, and then obviously anyone who's here can simply go there. And anytime anyone has any questions, our member support is there all the time. They can chat. We will talk to them. We can help them out. And then not only that, when they become members, every time there is any problem with any of their care, or even to get in doctor's appointment, I can't find an appointment, please help us booking, we do that too. So it's end to end. We have to help them because it's complicated. The healthcare system is complicated. So we will help them out. So they can go to the site, but they're happy. We are more than happy if they reach the member support, and we can guide them and help them out.
Perfect. Yes. Thank you so much again for sharing your time, for sharing this resource, and to making it available to the people. And thank you for being on the show.
Thank you, Ty.
Absolutely. No problem at all. And thank you for listening. If you're watching this on YouTube, you can find us on all of the audio podcast platforms, from iHeart to Apple to Spotify, and vice versa. If you listen to this as an audio only podcast, you can find us on YouTube. Search for Long Term, a podcast in recovery. And if you heard Ramdev say something here that was really impactful for you, you say, I know exactly who needs to hear this. I know who I need to share this resource with. The best thing you can do to help us grow this message and to get the message that to the people that need to hear it is by sharing this episode with them. The worst that can happen is they won't listen to it. The best that can happen is that you saved a life. And we really appreciate you for being here each and every episode, learning along the way with me, and finding out more about this entire world of what we need to do to make a sustainable future for those who are recovering from something. And we'll see you in the next episode.